In a recent video, the Protect Parents' Rights team presented very compelling evidence that the modeling which Governor Pritzker claimed to have relied on in issuing his stay-at-home order back in March was a work of near total deception. In fact, we would strongly assert that Governor Pritzker's enthusiastic participation in the entire flatten the curve notion was nothing other than the advancement of pure, unadulterated propaganda. In putting together our video, we made every effort to back up all of the information we presented with facts taken from public record and/or detailed explanations of the methods that we used. One item which has always intrigued us is the fact that although the number of COVID-19 positive ICU patients was slowly and steadily increasing in Chicago hospital ICUs in late March, the overall number of ICU patients and the available capacity of Chicago hospital ICUs remained quite steady, as you can see on this graph. Although hospitals can very easily and quite rapidly increase the available capacity of their ICUs, as a Rush University Medical Center doctor explained to Governor Pritzker's main COVID-19 modelers in this email, the Protect Parents' Rights team now believes we have identified a much more important to understand reason for this phenomena. Specifically, we would propose that a significant number of very sick patients already in Chicago hospitals or even already in Chicago hospital ICUs were being diagnosed with COVID-19, meaning a substantial percentage of the COVID-19 positive ICU patients were not new patients coming into the hospital. Let's listen to a clip of a Northwestern Memorial Hospital doctor who will be providing a snapshot into the patients who were dying in Northwestern's ICU of COVID-19, or should I say with COVID-19, in late March and early April.
So from our numbers, this, you see a lot reported around the globe in the literature about what people are seeing, and this is just a snapshot of what we've seen at Northwestern. So we've had a total of 4 deaths in the intensive care unit out of the 76 ICU touches, 76 patients that have been in the ICU, which gives us an ICU mortality of about 5.2%. And of the 4 patients that died, there was a little conversation going on before we started. We've seen the first 3 patients. One was a patient that had been in the hospital for about a month with uncontrolled lymphoma, had a lot of medical issues, and they thought probably contracted lymphoma or contracted COVID from a family member visiting, a week or 2 before he ended up in the COVID ICU, got over after having persistent fevers and was tested. We had one woman with very advanced emphysema who actually contracted it, and then the family withdrew care and she passed peacefully. And then this gentleman had a known history of critical aortic stenosis and an LVEF of 10%, got transferred into us with the COVID infection, did okay for the first 24 hours and then started spiking very high fevers, went into atrial fibrillation and sort of decompensated from a heart failure standpoint, and then the family transitioned him into comfort care and he passed away. We've really only had, in the last couple of days, this one patient who would be what I would think of more as like the classic COVID ICU death that you're seeing reported in the news, right? This was an older gentleman that had just a comorbid condition of hypertension, developed COVID pneumonia, came in, got intubated, and ended up on ECMO, and he ended up passing away.
So when we look at the leading causes of death for Illinois residents for the year of 2018, which is obviously long before the COVID-19 pandemic, we can see that all 4 of the ICU patients who died at Northwestern with COVID-19 had at least one of the top 5 causes of death for residents in the state of Illinois. And 3 of the 4 appear to have been severely ill prior to their COVID-19 diagnosis. And interestingly, the Illinois Department of Public Health provided the Protect Parents' Rights team this breakdown of the comorbidities that were present at the time of death for all deaths that were listed as COVID-19 as of May 20th, 2020, of which there were 4,525. As you can see, there were apparently 3,604 deaths which involved an additional underlying cause, as the Illinois Department of Public Health puts it. And looking at the numbers, it is obvious a number of these 3,604 deaths involved two or more underlying causes. This is clearly the most vulnerable portion of the population, and the governor's efforts at saving lives should be focused on them. So although the governor says that saving as many lives as possible is the one goal he will put above all others every time, what has Governor Pritzker really done to address the diseases that are actually causing the most deaths in the state of Illinois? And even worse, what did Governor Pritzker's administration do to make certain the most vulnerable to the COVID-19 virus were being cared for and protected during the worst of the COVID-19 pandemic in Illinois? Focusing on creating and harshly enforcing confusing and seemingly endless policies by edict to control the lives of the people of the state of Illinois as a method of saving lives seems misguided at best and seriously dangerous and counterproductive at worst. So while taking extreme action for the purpose of saving lives can be a noble pursuit, which most of the time is very difficult to challenge or criticize, many of the facts now coming to light strongly suggest that something very different is going on here in Illinois.